Hi there, everybody. Thank you for joining us today for our webinar on support services. Here at Q Consulting, we have been providing consulting services across a wide range of industry initiatives from consumer-driven healthcare strategy to revenue cycle management. One of the areas that we have seen a lot of interest in is patient financial advocacy in the form of support services. I hope you all enjoyed the webinar today. Let's get started. To begin, I'd like to start out with defining what support services is and the role it plays within the practice. Support services assist hospitals, infusion centers, and cancer care clinics gain access to financial assistance for patients to cover their out-of-pocket expenses, which in turn reduces the treating institution's bad debt and improves patient satisfaction scores. Patients with cancer often face financial hardships or financial toxicity, as we refer to it in the industry, including loss of productivity, high out-of-pocket costs, depletion of savings, and bankruptcy. So providing financial guidance and assistance through specially trained financial advocates allows hospitals, infusion centers, and cancer care clinics to mitigate the financial burdens on patients and minimize the financial losses for the treating institutions. There is a significant need for patient financial advocacy, not just for patients, but for the providers and the clinical staff as well. I think one of the more confusing or hard to see pieces for hospitals and infusion centers is how can they benefit from providing financial advocacy services to their patients? Ideally, you want to provide all the support possible to your patients within clinic setting as well as outside, but sometimes following through with the financial support piece can be cumbersome and it can interfere with the workflow of a busy clinic. There are great perks for the practice that come with implementing a support services program, such as huge financial benefits, operational benefits, and patient care benefits. And this is all done without committing to any additional FTEs. And these perks will be seen played out in the form of tremendous reduction in patient bad debt, drive patient satisfaction scores, and direct improvement to revenue and profitability. Several factors support the need for support services, such as the most obvious being the patient out-of-pocket cost associated with treatment. In the last decade, the annual out-of-pocket cost for healthcare has increased 230%. To think of that in other terms, the average burden on each patient is approximately $2,000, which for most is an unaffordable hurdle that is leading to millions of dollars of bad medical debt. By pre-identifying patients with high out-of-pocket costs, we search for alternate means of payment for the provider. We like to view this as low-hanging fruit that can be grabbed before it turns into bad debt and recouping the money becomes more complicated. Areas where support services can help are indeed the costliest for the patient in the healthcare industry, those areas being oncology, hematology, rheumatology, gastroenterology, and neurology. These fields of medicine rely heavily on infusion therapy, specialty oral medications, and injectable treatments, which do carry a big price tag for the patient. And the cost of treatment within these medical specialties is also hard to bear for the patient because they are being treated for complex chronic illnesses such as cancer. Cancer treatment costs continue to rise at a rate of 2 to 3 times comparatively to the other areas within the healthcare industry, and at least 30% of cancer patients do report financial hardship. Now, with that being said, cancer patients are also more likely to be unable to work because of their health due to the treatment, which creates a reduction in work hours, income, and employment-based health insurance options. The cycle of financial burden that chronically ill patients experience is referred to as financial toxicity, as I mentioned earlier. Financial toxicity is how the healthcare world has come to define the financial hardship that patients experience due to their high out-of-pocket costs, which many have reported to be more than 20% of their annual income. Patient satisfaction and patient experience are inextricably linked. As patient out-of-pocket responsibility continues to climb, the medical practice that takes the proactive measure to help meet the patient's financial needs and improve the patient experience will be the practice to prosper. They will come out on top. The direct correlation between patient financial experience and overall patient experience means that the patient satisfaction score does suffer when the patient experiences financial toxicity. When the patient receives bills for their treatment that they cannot afford, it does change the dynamic between the provider and the patient. The implications of the patient experiencing financial hardships are decreased patient treatment compliance and decreased patient satisfaction scores with their care. As providers, practice managers, and clinical staff, it is important to note that at least 30% of cancer survivors report financial hardship related to illness and treatment. Studies have found that this directly impacts patient compliance and adherence to therapy. Patients will abandon treatment, most commonly specialty oral medications, to save themselves from the mental and emotional anguish of financial hardships. You will often see patients do without specialty medications and infusion therapy to pay for pain management. In regard to treatment compliance, it is important to note that there is an active shift happening with IV chemo becoming available in pill form. Most oral oncolytics are great alternatives if it is a treatment option because they are less toxic than standard chemotherapy, which gives the patient a better quality of life during therapy. One of these that really stands out to me is Lynparza. Lynparza has recently been FDA approved for first-line active maintenance therapy for metastatic pancreatic cancer. And this is a big deal for pancreatic cancer patients because the side effects are significantly decreased and they do not have to be hooked up to an infusion pump that has to go home with them. So this is a fantastic alternative to traditional IV chemo for a patient who is as unwell as a pancreatic patient because it lends them functionality in their day-to-day during therapy because of the decreased side effects and not being tethered to an IV pole. However, we often see patients needing financial assistance with this medication particularly because there is a high out-of-pocket cost for the patient regardless of insurance type. We do not want the patient to have to forfeit chemotherapy or their quality of life in order to afford to pursue pain management instead, and this happens often more than not. These are some of the quotes that we have collected from speaking with patients directly who are in the throes of financial toxicity when we first reached out to them. This quote in particular, do I pay my mortgage or the bill that I just got in the mail for my cancer treatment? This quote came from a lady that by chance we discovered on a bad debt report. Upon reading through her chart, we saw where the nurse documented that the patient had decided to end her treatment because she was unable to afford her therapy. And the patient is in fact an LPN and she has an employee-based health insurance plan that had a high cost sharing amount and the max out of pocket was around $10,000, I believe. She did not qualify for any copay card because her cancer was being treated with off-label chemotherapy. But we were confident that we could obtain free drug for her future treatments, but she was carrying a hefty balance from her previous Udenica treatments. Fortunately, we were able to get 6 of her previous Udenica treatments replaced, and that cleared out a sizable portion of her patient balance, and then she resumed her treatment. It's extremely important to us that in addition to providing strategies to increase practice revenue and profit, that we also serve as a resource to the nursing and clinical staff. When these difficult conversations happen with patients about affording treatment, they know to lean on us to get those answers and work out how to make it affordable for the patient and their families. What our solution is to stop the financial toxicity process. And we do this by establishing a workflow that assesses the patient's financial standings, because what we want to avoid is the patient falling into that cycle of treatment-based financial toxicity. Now, the workflow that we have created for support services has proven successful in capturing patients who are in need of financial advocacy, but most importantly, it prevents bad patient debt for the hospital. To illuminate how we do this, I'm going to outline our successful workflow that identifies patients who are in current need of support services that have already begun their descent into financial hardship, and patients who are newly diagnosed and about to begin treatment. Step one is to identify the patients, whether the patients are already experiencing financial hardship or they are newly diagnosed about to begin treatment. We identify the patients who have high cost out-of-pocket responsibility. We do this by reviewing the clinic's infusion schedule daily for the upcoming weeks. We assess the patient's insurance, their disease status, the treatment plan, and the out-of-pocket responsibility for the treatment. Also, with any supportive drugs that they are going to be prescribed, any oral medications, and also if the patient has radiation therapy planned. After the patients have been identified, we then notify our client which patients will be in the infusion center for that week. We will have that point of contact request permission from the patient for us to seek financial assistance on the patient's behalf with an authorization to represent form, or ATR for short. Step two is to secure funding. The initial screen helps us to identify what type of assistance patients are eligible for. These include copay cards, open disease foundations, manufacturer patient access free drug programs, and other funding sources. For the disease funds that are closed, we do have a proprietary solution that is in place for instantaneous notification when a fund opens, so that patients can be added immediately and before the fund becomes fully subscribed. This is important for those high demand funds such as breast cancer, prostate, pancreatic, and ovarian cancer. With the information that we get from the ATR and the patient's medical record, we are able to apply immediately for the available assistance on the patient's behalf. After the patient has been successfully enrolled in an assistance program, we reach out to the patient, explain the program that we were able to enroll them in. We will request additional information that is occasionally needed. With some of the disease funds, they will ask for financial documents just to back up the information that was provided from the ATR. We will then explain how the assistance program works, and we advise the patient of our submittal process. We submit all the bills on behalf of the patient as soon as they are processed through the EOB platform, so the patient doesn't have to worry about doing that themselves or handing it off to somebody in the physician's office. We also make sure that the patient has our phone numbers so they can give us a call with any questions that may arise, and we encourage for the patient to maintain communication with us so that we can take this financial advocacy piece off of the clinical staff's shoulders. After funding approval, we monitor and submit all EOBs with patient responsibility, and we also follow up on any denials to ensure payment is received promptly to the provider. Ultimately, this increases patient satisfaction and reduces the financial burden on the provider's office or facility by guaranteeing patient out-of-pocket expenses are obtained, which reduces bad debt and increases revenue. This is actually one of my favorite parts of the webinar because the outcomes that I'm going to present to you, they're not projected outcomes. They are actual numbers that we have taken from our clients. So this is really exciting for me to show you. We are very proud to report that one of the outcomes is a 70% reduction in bad debt. And this is due to the proven workflow of ours that is super successful in remediating existing bad patient debt and preventing patients from sliding into the financial toxicity cycle. Obtaining those copay cards, disease-based grants, and free drugs through the patient access program, it really chips away at the bad patient debt for a huge result. Now I'm going to break down the outcome further. And again, these are not numbers that we have predicted as potential outcomes. These are numbers that are from actual clients of ours. You can expect to see an additional $80,000 in revenue per medical oncologist through direct revenue payments from copay cards and disease funds, $300,000 per oncologist for free drug received from patient access programs. Now, these patient access programs are intended for patients who are not eligible for copay assistance, such as Medicare, and if there is not a disease fund open or available for that patient. You'll see $20,000 per oncologist for direct help to the patient through premium assistance, urgent need funds, and travel programs. A lot of these disease-based grants, they will allow for premium reimbursement, insurance premium reimbursement. They'll reimburse for the patient to travel to and from treatment, and if the patient has an urgent need as well. We had a patient who received a grant from the Leukemia and Lymphoma Society, and she was using her grant balance for insurance premium reimbursement because the dates of service on her bad debt, they were too far out to submit for reimbursement from the grant. Every time she got her insurance premium reimbursement check from the Leukemia and Lymphoma Society, she took every penny of that check to make a payment on her bad debt. Within 6 months, her bad debt was completely paid off from the premium assistance grant she had through the Leukemia and Lymphoma Society. One of the outcomes that I touched on earlier is the operational benefit of support services. From our experience, most hospitals usually have nursing staff assume the role of financial support because, by default, the nursing staff are the first to hear patient complaints about health and finances. If it's not the nursing staff that handles the financial aid request, then it's usually taken care of by an FTE who is fulfilling dual roles within the physician office. So operationally, the burden of providing financial advocacy is shifted from the physician's office and the nursing staff to the dedicated support services team. We really seek to simplify the process and lighten the load of everyone involved at the practice through our proven solutions because there is so much follow-up required with patient financial advocacy. The reward from our job is the patient interactions because our position on the patient's care team as financial advocates requires intimate knowledge of their hardships. We often develop relationships with the patients and their loved ones. Our patients know that if they get a confusing bill in the mail or if they have trouble understanding what their out-of-pocket expenses are, that they can call us and we pick right up to help make sense of it and help strategize how they're going to afford their out-of-pocket costs. This quote here in the top right-hand corner of your screen actually comes from one of our nurses at a breast cancer center. This patient, she's only in her early 30s and was recently diagnosed with breast cancer. Her employee-based insurance policy did not have much coverage, and she faced a big out-of-pocket cost associated with her infusions. Now, during the initial diagnosis appointment, Her mother made the nurse aware of the financial hurdle her daughter would be facing. The nurse, who we work closely with, reached out to us to make us aware of the new patient who would be scheduled for treatment. We were able to get a copay card to cover her patient responsibility before she began her infusion. So thankfully, this young woman did not have to begin chemotherapy knowing that she would face bills that she could not afford. So a little bit about us and how we can help. Q Consulting Services is a full service healthcare consulting firm with the depth to address every aspect of your facility. We partner with both hospital and specialty care centers, helping them find their way to long-term relevance and functionality. We also work side by side with the patient, their clinician, and family members and manage each of the requirements needed to qualify and receive assistance. So what does this all mean? In summary, just to recap, your practice will see increased patient satisfaction scores, increased patient compliance and adherence to treatment, decreased patient debt, and increased profit and revenue. I would like to say that overall, our competitive difference is that we're not a technology company trying to get you to buy our software. So really, we are not going to be pushing our own operations or our own agenda as one of your eventual solutions. We have internal experts to recommend what we believe is right for you without any future conflicts of interest. And our mission is to focus on what is important for you and your patients. In determining what is right for your hospital, just set up a quick call with us. Honestly, in about 10 to 15 minutes, we can determine if we will be able to help you. There is a quick survey at the end of this presentation where you can check yes to receive a copy of today's slide deck. I appreciate all of your time and for joining me today. Please feel free to reach out to me and set up a quick call. Thanks.